what's up, everybody? I am Maggie Reichard, and welcome back to another episode of Nursing Uncharted. How is everybody? Thank you so much for listening, as always. Any prospective travelers, I wanted to give them a heads up. AMN is giving away prizes right now for applying and following them on Instagram. So if you go to their Instagram at AMN Nurse, click the link in their bio, and then click Your Passport to New Horizons, you can fill out a checklist there and win new scrubs and Amazon gift cards and more. So today's episode, we have a champion for empowering nurses, specifically in our more vulnerable population of nurses, our new grads and nursing students, but she speaks to all nurses, all levels of experience. And her and my missions kind of intersect when it comes to wanting to keep nurses in the profession, but also being an advocate for doing whatever nurses need to do to maintain their mental health and live their best lives. So today's guest is Katherine Weaver. Katherine has been a nurse for about 5 years now, starting out in med-surg and then has since dabbled in ER nursing, outpatient nursing, and now is going back to the bedside to start travel nursing with the hope to do some medical missions in between contracts. She has a YouTube channel, which she started 2 years ago, called Nurse Katherine Here, where she helps to mentor, educate, and create positive and inspiring content for the next generation and current generation of registered nurses. So, Katherine, welcome to the show.
Yeah, thank you so much for having me. I'm so excited to be on your podcast and reach more nurses out there.
Yeah, this is great. I'm so happy to have you. I love your YouTube channel. I think you got a lot of great stuff on there, a lot of variety, and
it's fun.
So tell me a little bit about your nursing background and what made you want to be a nurse, and then also your YouTube channel, what made you get started there?
Yeah, of course. So I grew up in a nursing household. My mom and her identical twin sister are both nurses. So nursing was like table talk, dinner talk all the time. So I just kind of grew up in a household of hearing about nursing. And then once I came into high school, I realized my dream of being a dolphin trainer probably wasn't going to work.
Shattered dream.
Yeah. So I kind of had to figure something else out. But I definitely think the Lord placed nursing on my heart in high school. And so all of high school, I knew I wanted to go into nursing. I initially wanted to go into pediatric oncology. I still have a love for that population. I just never have worked it. So after high school, I went to a community college for the first year of nursing in North Carolina. And then I moved back home. My dad was sick, so I had to move home, help take care of him. So I went to a nursing school. It was a diploma degree. It wasn't even a bachelor, or associate's degree. It was actually just a diploma degree, which is what my mom and my aunt both had when they went to nursing school. I believe there's only less than 10 diploma programs in the United States still. There might not be.
Yeah, you don't hear about a lot of diploma nurses anymore. That's cool.
So that was a 2-year program. You could go in right out of high school and become a registered nurse in 2 years. So with that being said, it is very fast paced. I failed a semester of nursing school. It was actually my second semester. And then I had to wait an entire year to retake that semester. So it took me 3 years to get through that program. After that, I then went online to get my bachelor's degree, but being frugal and not wanting to pay for it myself, my employer paid for it for me.
Nice.
Yes.
That's not frugal. That's smart. Work smarter, not harder.
That's exactly right. Yep. So I did that while I was working full time in my first position. That was in med-surg. Did that for 3.5 years because I didn't really know what I wanted to go into, and I didn't want to get into a specialty first just because I wasn't sure. I kind of wanted a mix of everything. So
a lot of people start out med-surg.
Yeah. So I got a wide variety of experience in that hospital. That hospital was over 700 beds. So it was a huge teaching hospital, level 1 trauma center. So you get it all.
Yeah.
So after that, I was like, this is old now. I'm ready to move on. I want to push myself again. So I went into ER nursing, which I told myself I was never going to go into. It was ER and ICU nursing. Always said, never, not for me. I want to actually talk to my patients. That's the kind of person I was when I first was a nurse.
Yeah. Weren't we all?
So I went to ER nursing, and it is so far my favorite type of nursing that I have done. So then did ER nursing all through the end of 2019 into 2020, and I became very burnout.
I'm sure.
Yeah, wasn't taking care of myself very well with it. My husband would tell you it wasn't that bad, probably because I would maybe put on a front when coming home. But just thinking about going to work, I didn't want to go. I had a lot of anxiety about going to work, all of that kind of stuff. So then we had to move, and we moved at the end of December down here to Atlanta, Georgia.
Okay.
And I was like, you know what? I'm done with bedside. I'm not going back. Went into outpatient nursing, and that started back in March, and I have done that up until recently. That was in an outpatient transplant clinic. So back into nursing school, that semester that I failed nursing school, my dad had a liver transplant. That was kind of gave me the heart to take care of transplant patients.
Yeah, full circle.
Yeah, so I was super excited, very thankful. I've had this opportunity in outpatient to work with transplant patients, but I'm ready to go back to bedside, and I'm going into travel nursing starting Monday is my first assignment.
That's awesome. Congrats.
Yeah, thank you. It's actually med surg again.
Oh, man.
Which is good.
We can't get away from it. Why are we doing this to ourselves? Yeah. I did the same. I felt like I went into the eye of the storm too, like going into the COVID ICU. Like, what are we doing? Yeah. We're going backwards.
Yes.
But that's awesome. Oh, I hope you love traveling.
Yeah, thank you. I feel like I've had enough time off now from bedside to feel like I'm like mentally ready to get back into bedside, and I actually miss it now. I kind of am over the outpatient world. Yeah. If you want to say.
I feel like there's something to be said about like sometimes we just need a little bit of stability for a little bit of time. Yeah. And traveling is great for that, because if you want to do, if you did like a really tough 3-month assignment and then your next assignment, you just want to chill for 3 months and do like clinic, or, I mean, it's a different type of busy, but like if you wanted a different, routine, you can do that. You're in charge of your own, whatever you want out of nursing. Traveling can do that for you. So
yes. Yeah. Which I'm very excited about. And you can take off as much time as you want between contracts, which is great. Yeah. To pursue other things like my YouTube channel. I can focus on that for a month if I want to, or medical missions. And it's there's so much opportunity with travel nursing, which I'm excited to see that fan out here.
Yeah. Let's talk about your YouTube channel. So how did that come about? You've been doing it for 2 years now.
Mm-hmm. Yeah. So, that was just a love for helping nurses and nursing students. I saw so much burnout when I was even a student. I saw burnout. And then, of course, getting into nursing that first year is so tough for, I would say, every new grad. Yeah. That is a rough year, because you think you understand it in nursing school and you think you know what it's going to be like, and it's something totally different, which is what I hear from so many new grads. Yeah. So I did a video recently or a few months ago, and it was talking about statistics of nurses leaving bedside and how many nurses quit within the first year working. It's insane.
Yeah.
It is absolutely insane. And it breaks my heart seeing that, because you spend so much time, money, possibly, on getting this degree. And there's obviously a reason behind every nurse wanting to go into nursing.
Right. Yeah.
And
you have an idea in your head of what it's going to be like. And there's so much time and effort and aspiration that goes into it. And then you leave within a year. It's like, what happened between, is it so starkly different, because it is.
Yes. Yes. And I think also just the wanting for having new grads and new nurses or student nurses having a good preceptor. I saw a huge lack of that. And just having someone who's devoted to pouring into them and helping them. Because the nursing instructor can only go so far when you have 10 students on the floor. It's really such a primary goal. If you're paired with a student for the day, you have to pour into them and show them the reins of nursing. Honest with them, but not be mean to them or belittle them. So that really inspired me also to create my YouTube channel. So I could kind of be like a preceptor, but not actually be with that student. Yeah,
like a supplement, like if they're not cutting it for you, let me kind of pick up the slack a little bit.
Yes. In this 4-minute video, in this 5-minute video, let me try to help you a little bit more.
Well, that's awesome. So what are some of the main topics, would you say, that are on your YouTube channel, as far as, you have like some educational things, like breaking down certain concepts, but then you also talk about, more, big kind of relatable topics to nurses, and like burnout, or like what are some, I guess, how would you identify different topics on your channel?
So like you said, I always post an educational video every week. So typically every Wednesday or Tuesday I will post an educational video, and that primarily is just more so focusing on helping students or nurses learn that subject better in a way that they can understand. Sometimes there's a disconnect there between instructors and students, I think, where nurses can't quite, or students can't quite understand it. So I try to break it down in a different way. That always helped me in nursing school. So I enjoy doing that. I enjoy the education side of it. But then Saturdays are kind of a free-for-all. I like to do stuff that's relevant to what's going on in nursing at that time. This upcoming Saturday's video will be a career update for my career. So just stuff like that. Because I don't want people to think I'm not like reachable. I want them to know what's going on in my career as well. But then also, I don't know, like the best nursing shoes and trying out sneakers and scrubs and stuff like that. Just everything nursing is what my Saturday videos are always about.
That's awesome. So it's twice a week, essentially? You're posting twice a week?
Yeah, twice a week.
How much time does that take out of your daily life to do like a full-time nursing and then also like full-time entrepreneur with your own YouTube channel? Like, we're always talking on here about work-life balance. I mean, how does that work for you?
Yeah, so I am very thankful that my husband supports me 100% in this. And like I said, this was his idea of my YouTube channel. So he is very supportive in that, with like, he'll cook dinner one night instead of me cooking dinner one night, little things like that. But time-wise, in the beginning, it took me forever to record videos because I would stutter a lot. I wouldn't know how to talk to the camera. It was bad. So it used to take me probably an hour to record one 10-minute video. Now it takes me like 10 minutes to record a 10-minute video. And then the editing process Educational videos are harder to edit because I like to put in text on that video. So that normally takes about 30 to 45 minutes. And then to upload that to YouTube takes another 20 minutes maybe. So all in all, one video typically is about an hour and a half, maybe 2 hours, depending on how in-depth it is. But if it's a Saturday video, that could be done within an hour.
Okay. So you've got it down to a science, essentially.
Yeah. And I structure my week of knowing what days I'm recording. And sometimes if I have a lighter week, like this week I'm off before I start my new job on Monday, I am recording 4, 5, or 6 videos to last me the rest of the month kind of thing. So then I don't have to think about it for another couple weeks.
Yeah. Oh, that's awesome. We'll be right back to our interview. Grab a cup of coffee, but don't go anywhere because we want to talk to you about our podcast partner, American Mobile. No matter your specialty, American Mobile has endless travel nursing opportunities. With the largest clinical team of all staffing agencies, American Mobile is ready to support you in achieving your career goals. To learn more about the benefits of American Mobile, like higher earning potential, premium health coverage, and 401k matching, make sure to visit AmericanMobile.com to speak with a recruiter. Again, visit AmericanMobile.com to discover your next travel nursing adventure. Now, back to the show. So you had said that your husband was kind of the main, person that propelled the YouTube channel. And I thought that was funny because my husband kind of propelled my podcasting too. He was kind of like, nobody else is doing this. If you feel like there's a need, you should do that. And so I thought that was hilarious. Like, husbands fan.
Yes, I love that. They're always motivating us, right? To do something else.
It's very important to have a good support system, especially when you're trying to do 2 different jobs. Just him cooking dinners while you get your stuff done, it goes a long way. I think one thing that you kind of honed in on in your mission with your YouTube channel is how important this transition from nursing school to actual practice is, and how those first few months or really that first year can make or break a nurse's outlook on nursing. Am I right on that?
Absolutely. Yes. If you are in a toxic work environment, that is not, first of all, that's not okay. That should not be okay for a nursing floor or an outpatient setting. It breaks my heart seeing toxic work environments for new grads to go into, because I know what's probably going to happen for them is that they will see that, they will hear maybe complaining, they will just be around that toxicity, and that
it affects their confidence.
It's just not
work ethic, it affects your ability to overcome obstacles. Like if you're doubting yourself, and as a new nurse, you feel so vulnerable, and, I feel like new nurses at that age in the first year, there is a high risk for burnout in that amount of time, because you're also battling, like, do I really know what I'm doing? Am I competent enough to, get through this? And so like having that, work environment, having mentors and people that you can go to it's such a pivotal time.
And not to mention, so many new nurses are young. So this is their first, a lot of nurses, this is their first big career. And they're just learning how to become an adult on top of taking care of other people and like actually having people's lives in their hands. And when you are so susceptible to being in that environment and just having that around you, it just does not work well. And it's so crucial that new grads understand not all nurses are like that and not all jobs are like that.
Yeah. You don't have to stay in that job that you're in. But that goes, it's when we start new jobs as new grads, sometimes it takes a lot for a hospital to hire a new grad. Sometimes it's easy, sometimes it's not. I feel like it kind of rotates in that way. But like for me, I felt very indebted to the first job that I got because they hired me as a new grad and I knew nothing, and so like you feel indebted, like you need to stay. But if it's a job that's not serving you well, you have to think about your own mental health and how this job that you're currently in is going to affect you long term, because your first few months and your first year is going to build up how you are as a nurse, like your nurse personality.
One thing I always thought about once I became a new nurse was trying to look back to those awesome preceptors that I had in nursing school and just like focusing on that and remembering how their attitude was. And just remembering like, oh, I really love this one preceptor because she did this. Let me try to do that and see if I can fit that into my nursing personality. Like you said, that was a very good way of putting it. I love that. So just remembering that too in that first year, I think is very important as well.
Yeah. And precepting and nurturing other nurses' development is obviously a passion that you have. So I'm sure you have advice for nurses who may all of a sudden find themselves in a precepting role. Like we've all had that sprung on us before, being a preceptor for the day. What are some maybe helpful reminders for those nurses who might have a new grad or a nursing student, maybe a traveler for the day that we should remember as preceptors?
Yeah. First, I would say just be patient, especially with new grads. Just be patient. Remember, they do not have the knowledge that you have. I know when I was a new grad, I felt like every patient was going to die every time I went to work. I was so nervous. And you gain so much knowledge that first year. And to just put yourself in that person's shoes and say, okay, what was it like when I was a new grad? You may have been super academically smart, but maybe your skills weren't as great, or maybe your skills were really good and you weren't as academically into it as you were for skills. So just being patient and remembering that first year of nursing is where you are going to learn probably 10 times more than what you learned in nursing school.
Yeah.
So just be super patient with students, travelers, new nurses. Yeah. And we're all human. We all make mistakes.
Yeah.
And I don't know, I hate bad work environments. And why would you want somebody with you during the day who you're not enjoying that time with each other?
Yeah.
That's time to pour into your nursing and help create another awesome nurse.
Yeah. It's funny that you say that we really do learn so much in that first year. I remember when I was a brand new nurse, my orientation, my preceptor would say, like around 2 or 3 p.m., my eyes would just glaze over. And I just couldn't take any more information in. Like I was done. I couldn't.
And were you ICU? Is that what you started off in?
No, I started out med-surg too. I was neuro specific. And so it was specialized but it was acute care. So we kind of got a hodgepodge of everything, but yeah. And I remember too, little things trip students up. I mean, and you have to, make space and time for that. I remember this one time, it's so cringy to even think about. I think it took me like 10 minutes to move an IV pole from one side of the bed to another side of the bed. And I don't know what was what. Like, now I'm thinking back, but I remember it being such an ordeal and like just little things. And my preceptors were like, probably what is taking her so long in that room? But I don't know. I think I was just being cautious, and you just have to like keep space and be patient. Like you said, just constant. It takes a lot of patience to be a preceptor.
Yes. And I think it's a kind of like an honor to even be asked to be a preceptor. I know right now, because of shortages, you're kind of forced into it. Some people are being forced into precepting, but some places you're not being forced into it. And I do think it's an honor to be a preceptor, because your manager or your educator sees something in you to be able to teach somebody else. So I do think you have to put that into perspective too, for people who are preceptors.
Yeah, absolutely. I mean, that's how it should be, right? That's how you really foster great nurses, is people that want to precept, that, have been trained in precepting, that work with manager and maybe your other preceptors that supplement, and come up with a plan and understand your learning style and all of that. I mean, in a perfect world, that's how it is. But I mean, we get the amount of I work at a teaching hospital, so we get nursing students all the time, and we get a whole batch of nursing students, not just a couple. And so everybody's kind of assigned to a student for the day. I will try and spend a little bit of time like doing little pieces of education here and there if I can. Like, on the neuro floor, I used to like look up CT scans and like trying to like give little pieces of information, like, like this is why this person is, has a headache, or like this is where their cancer is, or so just being able to piece little things like that in here and there, I think is really important.
Absolutely. And just them watching your everyday assignment, like how you attack your assignment, because I think that's a big struggle also for new grads and new nurses, is how do you go into that, I don't know, 3, 4, 5, 6, 7 patient assignment, 2 patient assignment, or even a 1 patient assignment, depending where you're at. How do you tackle that? And having a student watch that with you, you don't even have to be saying something, but them just watching your actions, I think is very helpful.
Yeah, absolutely. I think, that's really important to see, how you break up your day, and especially on the med surg floors. I mean, those first 30 minutes of getting a report on 4, 5, 6, I can't even imagine 7. I've never had 7. No, I've been so blessed to not have 7, but I know many people that have. But to get, how do you even get a report on 7 people in 30 minutes? I have no idea. Bless whoever does that. Yeah. But figuring out how the day is supposed to be set up. I mean, that's how your new grad or nursing student is going to set up their day. It's like, it's a big responsibility.
Yeah, it is. Absolutely.
Something that I found out about you when we were talking for the first time is that you've incorporated missions trips into your nursing practice. And I want to talk about that a little bit, because I have as well, a little bit. So can you speak on that? What have you done so far, and how's it changed your nursing practice?
This is really the true heart behind nursing, that I didn't figure out until later into my career. But later in my career, like in nursing school, I really wanted to incorporate the gospel, but nursing as well into one. Some places you can do that openly, some places you can't do that openly. So a few of the things that I have done in nursing school was local homeless shelters, stuff like that, I had the opportunity in nursing school with other students to do that and serve meals. I created a walk-a-thon to bring awareness to liver disease and alcoholism, because, like I said, my dad needed a liver transplant, and that was due to alcoholism. So that was really a passion of mine as well, and just bringing that awareness to the community and educating the community and just helping the community outside of the hospital setting. So that really was like my first kind of mixed into medical missions.
Did you facilitate the walkathon?
Yeah, I was 19 when I did that.
Oh my gosh. I missed that.
Yeah.
That's incredible.
Yes. So I did that when I was 19. He got the transplant a few months after the first walkathon. And then we did it 2 more years after that. And then the other 2 years after that, we incorporated the Gift of Life Foundation organization into that, which is our organ donation organization that was in Pennsylvania. Because my dad's liver was from a friend of mine who passed away. Yeah. So that was,
oh my gosh.
Yeah, it was a really special thing. And, his family landed my friend who passed and my dad, everyone was walking together and it was really, really cool. So that was my first dabble into it. And then I started my med-surg career and I was like, okay, I need to do something else other than just this. So they had a street medicine there. So I and another nurse and normally about 2 or 3 other doctors would go out in the streets of the city that our hospital was in and just provide care at homeless shelters, tent sites, all of it, just basic things. And then through that, I found a faith-based organization that I am still involved with. It's called Faith Care. It's up in Reading, Pennsylvania. And with them, I would do monthly clinics. They're free clinics for anyone, everyone, whoever would come in. And through Faith Care, they do international trips as well. And that's who I went to Nigeria with back in 2019. Great timing, right? Right before COVID.
Yeah, really. No kidding.
I did a 15-day trip to Nigeria out in the middle of what felt like nowhere. Felt like I was in a rainforest I think we kind of were in a rainforest. We saw over 7,000 patients in 10 days. And I was the only triage nurse during that time. I had no experience in triage nursing. This was right before I went to the ER. It was between my med-surg and my ER time. So left med-surg.
So it's like a little orientation into the ER.
Yes, it was great experience. So that was amazing. I learned so much doing that trip. There were malaria. There were diseases like malaria. That is like the first word that comes to my mind. From being over there, I was treating pediatric patients, had no experience in that, but I was the only nurse giving injections and giving meds. It was wild. Now that I look back at it, I realized how crazy it was. But it was...
You really do everything.
Yeah, you do. And the people were so thankful. Incredibly thankful, because some of them were in their 60s, 70s, never saw a doctor before. Some of them do see doctors regularly, but wanted to come see us. But the other thing I liked about that missions trip, which is what I really look into missions trips for, like when deciding to go on one, is this sustainable once we leave? Is it going to be sustainable for that people group that we're going to see? And we partnered with, I think there was 200 of us, like doctors-wise, Nigerian nurses, that we all partnered together, and they were treating their own. It was like a local missions for them, but international for us.
Okay. I see.
People, are still being treated over there. Faith Care is actually building a hospital over in Nigeria, helping to educate doctors over there. So that was my biggest missions trip, I guess I should say. And now coming up, I'm in the process of being hired with a organization. I don't want to say yet because I don't know if I'm hired yet, but that will be hopefully, Lord willing, in between travel nurse contracts, doing 3 to 4 week disaster response missions trips coming up. Yeah.
That is amazing. Oh, it's such a enriching, fulfilling, thing to do as a nurse, going over it there. And you learn so much, like you said. I remember I went to Kenya, in 2013, but I went with my school. I remember, we did triage. We were the lab tech, like we would run, like HIV tests. We were the pharmacist. We would count pills and, put them in little baggies and write instructions on the bags. And, you were giving medications, you were assessing, we did peds. It's just, it's so all of it. And I was a nursing student at the time, so I wasn't even, a nurse yet, but it's just amazing the experience that you'll end up getting over there. And like you said, how grateful and thankful everybody is. It was a great experience for me too.
Yeah. I will say when I came back from that missions trip, I really had to kind of like check my own heart towards my attitude towards patients. That was something I did not foresee coming. I've always felt very passionate towards my patients and very caring towards them. But once I came back from that mission trip, seeing what I saw and then going into the ER and seeing what I saw there, and I'll say it like that. I think you know what I mean.
Finger lacerations or something, like abdominal pain. And you're like, but do you have, worms in your feet? No.
Yes. Someone complaining about like a 2-hour wait when I just had someone in Nigeria walk for 3 days straight to come see us. Like that was something that I was not anticipating. My attitude towards my patients when I came back, which I'm thankful that I did have that, so I could learn from that. Attitude change that I had to deal with, but that was something, I just was not anticipating, how I felt towards my patients I was taking care of here in America versus somewhere else.
Yeah. I didn't even think about that. I guess because I was a student, so I didn't get that. I remember feeling so overwhelmed with the abundance of the amount of things that I had and how big my house was when I came back. I remember like just looking around and I think I broke down. I was like, it's amazing how much we have. We don't think about that.
Yeah.
I mean, in this apartment, I could fit, 30 people.
Yes.
30 people would live in this apartment with me,
Yeah, it really puts your entire life into perspective, for sure.
Yeah. Yeah. Another hot topic that I noticed that you talk a lot on your channel, we talked a little bit about it already, is nurse burnout, which is something that is ever present. We see it all the time. And in fact, I mean, I was thinking about it more in creating the outline for this episode. And I honestly, unfortunately, I think that we see nurses, there are more nurses now that are burned out than nurses that are not burned out in some fashion. I mean, think about how many people are exhausted, in a bad mood, tired, apathetic, and then think about the amount of people that are ready to work and well rested and well tempered. It's very off balance right now. And I want to kind of talk a little bit more about nurse burnout in the nursing, new grad nursing aspect. What are some tips for new grads in that first year that are feeling burned out that you think that should be said if they're starting to have those feelings, or maybe in prevention mode to kind of shield themselves from that?
Yeah, that's Yeah, definitely a hot topic. Like you said, it does seem like that. It seems like more people are burned out now than people who are willing to and want to go to work.
Yeah.
So new grads wise, if you see that burnout coming, or if you are burned out, I would say take a break. Honestly, it's okay to use your PTO time. And I understand we don't get a lot of it. I do get that. But there are such things as mental health days to me. Like, sometimes you do need that. And it's okay. Like we were talking about before, it's okay to leave a job if that's what you need to do. That's what I did. I left ER nursing and went into a different kind of work. Granted, I might have cried when handing in my resignation letter every single time. I've always resignated from a job. But because I feel passionate about those people I was working with, but you are not married to this job, and you need to take care of yourself, I would guess. I should say you have to take care of yourself before you take care of a patient. And finding those ways that help you take care of yourself, whether that's going to the gym. Mine was going to the gym, reading my Bible, and praying, lots of prayer, tons of prayer. And just fully understanding that your life does not revolve around this job and you are not defined by your job. And just know
I like what you said about taking PTO.
Yeah.
Because I think when I was feeling that way, I think I was worried that to leave, I didn't want to leave my city because I was like, oh, I need an extra day to kind of prepare for the shift. And then, I always thought there was like not enough time, but like leave, like go on trips, like use your PTO.
Yes. And I think when you put yourself in the mindset of like what you said, preparing for your next shift, what is it that you actually have to prepare? Like, what are you mentally preparing? You know what I mean? Why not enjoy this entire day and not think about your whole next shift? Because that is mentally exhausting. When you take a whole day to prepare, to think about how exhausted you're going to be the next day, I find that very exhausting in itself. So like that would be something I wouldn't do. I know some people, like you said, you have done that, but like you said, leave, just go on a trip, go for a hike that before, I don't know, go do something.
So one last, takeaway from this episode, what should listeners, take away in regards to how to empower other nurses on their units, to just promote positivity and prevent burnout? What are some ways that we can empower our other nurses?
Yeah, I'd say one way that I always like to do was incorporating a quote of the day or a meme of the day, some kind of joke, something to get people happy in the morning. Especially for the day shift 12-hour nurses who are like, don't talk to me yet until I drink my coffee. But I was that person. I didn't care. I was like, I'm going to talk to you anyways because you need some positivity in your morning. So not being afraid to just be happy around those people and try to kind of get into them a little bit. And just, I think there's a lot when you are promoting positivity yourself, when you are just joyful yourself, that's going to rub off on the others around you. And I would definitely say try to do that because it goes both ways. If you're not joyful, then that's going to spread to everybody else.
Well, I think we are going to end it here. But Katherine, thank you so much for being on this podcast with us today. I think that there was a lot of great gems as far as preventing burnout and, just be patient with your orientees. And I look forward to watching more videos on the YouTube channel.
Yeah. Thank you. No, thank you so much for having me on here. I can't wait to promote your podcast to let students know that this podcast is out there, nurses. So we'll be looking forward to a shout out here in a video of mine.
Awesome. I'm looking forward to it. Thank you so much.
Yeah.
Well, we will talk to you soon.
All right. Thank you.
That brings us to the end of the show. Thanks for tuning in to Nursing Uncharted. To learn more about today's episode, make sure to explore the show notes at americanmobile.com/nursinguncharted. And don't forget to subscribe so you never miss a guest. If you're a nurse interested in traveling, visit americanmobile.com to explore the largest database of travel nursing jobs in the industry and the amazing benefits that American Mobile has to offer. Also, a special thanks to producer Jonathan Carey, assistant producers Katie Schraubman and Sam McKay, and Aiden Dykes for the music and editing. Until next time, take care of yourself.